when we vilify co-sleeping and only teach these rigid, shame-filled rules, the reality is that many parents resort to co-sleeping out of desperation.
Yeah.
And if it's this shameful thing that I can't tell anybody about, then a lot of the safe co-sleeping practices go out the window. So however we're going to sleep, we need to do it as safely as possible.
There's so many groups, right? We have the very, very anti-sleep training, anti-cry, don't do any of that. And then we do have the very anti-co-sleeping. And I want to be clear that it is something that I know that if risk can be reduced and that family understands that risk, if that's what they want to do, I'm all for it. I'm okay with it. And I've had very personalized discussions with my own families in my office about it, right? And that goes against your official AAP guidelines.
Parents resort to co-sleeping or unsafe sleep practices when they're desperate. So instead of just sending parents home with a to-do list of don't you ever do this, but also good luck, figure it out. If you're desperate, sucks to be you. Let's teach some safe sleep guidelines, but also teach parents some tools so that they can have safe sleep and good quality sleep.
Welcome back to the Pete's Doc Talk podcast. It is Dr. Mona. And if you're watching this, you are on our YouTube channel. And I say this every time, don't just watch and lurk. You have to subscribe because that's how I can make this channel continue to grow. And that's how I also know what sort of videos and conversations you want me to have on this channel and on the show, the Pete's Doc Talk podcast. And as you may know, the Pete's Doc Talk podcast is one of my favorite mediums. And now that we have it on video, I just love to be able to have this sort of conversation in a different format. Today's guest is another favorite. Chrissy Lawler, LMFT, is a licensed marriage and family therapist with 15 years of experience, as well as the owner, founder, and CEO of The Peaceful Sleeper, where she offers coaching, courses, and resources for parents to achieve better sleep and something really important to me, mental health, which is so critical not only for babies, but for themselves. Her central premise is that quality sleep is critically important for the whole family system, but it doesn't matter how we get there as long as we do already. I mean, just the intro is making me feel so warm and fuzzy. Thank you so much for joining me today, Chrissy, as we talk about something that's going to be surprising to a lot of people that a pediatrician's talking about, co-sleeping.
Yes. Thank you so much for having me. This is such an important conversation.
Yeah. And so I want to kind of backtrack as to why this conversation is important about co-sleeping, because sometimes people hear a pediatrician will never recommend it. And there's a little bit of a backstory behind this, because of course I was trained in AAP recommendations, which is, we don't recommend co-sleeping on your back, all of these things. And then I started having friends who were having babies. This was well before I had my own children. And a lot of them, whether they were in the medical field or not, were co-sleeping. And I was like, I would tell them like, it's not the ideal situation, but they were like, Mona, it's the only way I'm getting sleep. And, we try to, we make it as safe as possible. And I was like, you know what? You're my really smart, educated friend. I'm going to let you do what you do. And then fast forward a few more years, and I had this very famous, highly followed pediatrician on my podcast called Dr. Imran Patel. He's a doctor in India. He's a pediatrician. And we were talking about how common co-sleeping is in India and how he doesn't vilify it. It's part of the culture. And as I started getting more into the reality of parenting, the social, cultural, personal things that I've heard, I started realizing that if we continue to ostracize, vilify co-sleeping, we're not fully offering the full educational breadth of co-sleeping. And I'm wondering what your thoughts are, because of course we know that there's risks that can happen with co-sleeping, but what is your approach when it comes to providing evidence-based resources, safety? Where is that balance where you lie right now?
Yeah. So I think it's such a dynamic conversation, and there is no one size fits all for every child and every family system. And I think the polarized way that we talk about many issues ends up taking options away from families or making them feel stuck or shameful. So I would much rather have an open conversation where we can look at the pros and cons of various situations so that parents can feel informed and proactively, conscientiously make choices that are going to work for their family.
Mm.
I generally, I'm a sleep consultant. I deeply believe in sleep training. There's really good evidence and data about sleep training. It is safe and effective. It is a tool that parents can have in their toolbox. And as a therapist, I also recognize that we need to be looking at the whole big picture. Not one thing is going to fit for every single family. And I
Mhm.
think to your point, when we vilify co sleeping and only teach these rigid, shame filled rules, the reality is that many parents resort to co sleeping out of desperation. And
Yeah.
if it's this shameful thing that I can't tell anybody about, then a lot of the safe co sleeping practices go out the window. So, however, we're going to sleep, we need to do it as safely as possible.
Oh, and that's exactly why I wanted to have this conversation, and I'm very aware that there's so many groups, right? We have the very, very anti-sleep training, anti-cry, don't do any of that. And then we do have the very anti co-sleeping. And I want to be clear that it is something that I know that if risk can be reduced and that family understands that risk, if that's what they want to do, I'm all for it. I'm okay with it. And I've had very personalized discussions with my own families in my office about it, right? And that goes against your official AAP guidelines. But I'd also like to be clear that the AAP website, which is Healthy Children, that gives a lot of educational website, on their website they talk about, and I want to say this so that we're all very clear on where we stand here, that, never sleep with your baby based on the evidence. They don't recommend it, and that's an AAP recommendation. That's not a international recommendation. But they also talk about when it's more risky. And when they do that, it's a way of providing that education of like, hey, we know it's going to happen. We
Mhm.
know, like, we don't want it, but we know it's happening. And like you said, to your point, having the conversation about being open about it. I don't want a family coming in and telling me lies about the sleep and then they're doing it unsafe. They're falling asleep on a couch. One of the caregivers is using drugs or medications, right? Like that can make it more risky. I want us to have that open conversation so I can say, here are those ways that makes it risky. And I know we'll get into that. But that is what you said beautifully. I just think we do a huge disservice by polarizing on either side because I see it when I see pro co-sleeping accounts vilifying the sleep training and I'm like, no, 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 no. I want to learn from you. I really want to learn from you, but because I don't know as much about what you're teaching, but I also will not stand for vilification of the other end and also the other side as well. And I think it's nice to have that personal perspective of like the amazing friends that I have who did it and also clinicians as well. And also talking to that doctor from India really opened my eyes on like, hey, what are we doing here when we know that it can be a very cultural practice and like as long as they understand what they're doing, we can support that and say, hey, how can we create good healthy sleep habits whether you are with your child or you're not?
Mhm. Yeah. And one of the things too that I think flows into this is optimal sleep education.
Yeah.
I'm working on another project right now. I have a nonprofit and we're getting sleep resources and mental health resources distributed through the hospital immediately after women have babies. And one of our key hypotheses is that if we can teach quality sleep optimization techniques, not just the rigid rules, safe sleep will increase because
Mhm.
parents resort to co sleeping or unsafe sleep practices when they're desperate. So instead
Mm.
of just sending parents home with a to do list of don't you ever do this, but also good luck, figure it out if you're
Yeah.
desperate, sucks to be you. Let's teach some safe sleep guidelines, but also teach parents some tools so that they can have safe sleep and good quality sleep.
And so, one concern I see clinically is that when parents feel judged or fear being told they are doing it wrong, they're sometimes not fully honest about how sleep is actually happening at home, right? And that
100%.
is my concern, and that's why I wanted to have this talk. Is that lack of transparency can increase risk. So, how can we create these safer conversations where parents feel comfortable being honest about sleep choices, so we can give clear guidance that includes both tips for independent sleep, healthy foundations, and practical risk reduction when co sleeping is happening?
Yeah, I think it comes down to really kindness and openness.
Yeah.
I think our we have a really interesting dynamic happening where there's a lot of misinformation. topics have become very polarized, and it's very divisive and unkind. And so when
Mhm.
parents feel judged for what they are doing, they stop being open about it. And so I really think the first step is recognizing there is not one right size fits all. And we have to just look at the whole picture and take away some of the parent judgment so
Mhm.
that we can know the actual picture. So I kind of have three things that I think are important for every parent and every provider as we are navigating the situation. Number one, I want to make sure that everybody's making decisions based off of good information.
Mhm.
Let's fact check, let's go to the data, let's come from a place of being evidence based so that we can make decisions with good information. I also want to make sure that the choices we're making are genuinely benefiting the family system and that everybody's actually thriving. And then I think we need to be nicer to each other. We are all in this
Yeah.
together. We are all out here trying our best. And I really think that if we have those three aspects buttoned up, conversations about sleep practices and parenting practices in general and our kids' well being will be way more productive.
Oh, I agree with you completely, and I think that's why I tend to get defensive of sleep training because, of that polarization that I see from the other side, but I'm also well aware that it's happening on the flip side as well. Like, meaning in my sort of, you must independent sleep, you must do this, and it's really, it's something that we all need to work on, and when I have these conversations in my office, and again, I don't give general advice online about co-sleeping because I think it's such an intimate conversation that I want to have, asking about the family, asking about risk factors. And so for anyone listening, this conversation is not a, hey, a pediatrician I listened to online is saying that co-sleeping is okay. It's more of, hey, get the information like Chrissy's talking about, from all of the information, speak to your child's clinician, make sure the medical issues that your child has, have that sort of healthy, nuanced conversation with them. So I often say that if co sleeping is working for a family and they're not asking for a change, the conversation still has to include safety, right? Because that is something, as a pediatrician, I have seen the risk factors of certain co sleeping situations. And so, because of that, I'm coming from a lens of, I don't want to be fully like, okay, go forth and do it all. But I also want to be very balanced on, okay, what are the ways that we can do to reduce that? So, when families are going to co sleep, no matter what, to you, what are the most important harm reduction principles that they should understand if they're approaching co sleeping?
Yeah, so I have four main considerations that I want to look at and assess when we're thinking about co sleeping. First and
Hmm.
foremost is safety. We have to make sure that it's a safe sleep environment. Co sleeping doesn't mean that anything goes. So I think the most important factors to consider as far as safety are parent sobriety,
Yeah.
also parents' general sleep practices. I'm one that I sleep fully on my side on a body pillow. And so sleeping on top of something is a habit that I've been in for 20 years. That in and of itself made co-sleeping very unsafe for me. It's
Hmm.
never something that I even wanted to consider because I'm used to sleeping on top of something, right?
Yeah.
Also, little things like even melatonin or a glass of wine before bed makes co-sleeping significantly more dangerous. And a lot of times parents just bring a baby into their bed where we have plushy, fluffy mattress toppers. We have big, thick comforters. That is not safe. Or, we have a baby swaddled in bed with us. That's also not safe. And we need to make sure that the environment, we don't have babies that could roll off the side of the bed or get stuck in between the mattress and the headboard. So, like you said, we can't just say co-sleeping, do what works for you and just go forth and enjoy. We do need to make sure that safety is buttoned up. The
Mm.
second
And
thing that oh,
yeah. No, go ahead. Yeah.
the second thing that I really pay attention to when we're talking about co-sleeping is the question, is baby genuinely getting deep restorative sleep? The reality is, a lot of times co-sleeping babies are stirring really frequently with every
Yeah.
mom and dad's moves, their snores, their shifting. They maybe are waking up 10 times a night to nurse. And yes, maybe it's less disruptive than if they're waking up and they're down the hall, but a baby after a certain age shouldn't need to eat 10 times at night. So that's
Right.
number 2, is baby genuinely getting deep restorative sleep. Number 3 is really important. Are parents genuinely getting deep restorative sleep? Co-sleeping families often make the trade-off that I'm not getting good quality sleep, but my child is, and so it's worth it. Or I'm getting woken up 10 times, but at least I can just roll over and nurse back to sleep quickly. If I had to walk down the hall, that would be much more disruptive to my sleep, which, yes, true. And also, some independent sleep skills interventions could make that 10 times at night be 0 to 1 times at night. And so, if mom and dad are not genuinely getting deep restorative sleep, the family system is not thriving. And so we have to make sure that mom and dad are getting good sleep. It boosts attachment, it boosts your
Yeah.
engagement during the day, it boosts your relationship with your kid, your job satisfaction, your work productivity, your health, your mental health. It's really, really important. And I think sometimes we neglect prioritizing mom and dad's well being and their mental health because we'll sacrifice anything for our kids, but some sacrifices are not worth it. And then
Mm.
lastly, I want to make sure that mom and dad's relationship is thriving if you have 2 parents in the home. Very often, co-sleeping turns into partner separation overnight. And I've been a marriage and family therapist for 15 years. There are a million ways that having babies comes in between your relationship, and we cannot take our relationship health and satisfaction for granted. I hear a lot of people say, like, these years when our babies are little, we are all hands on deck in support of the babies. We'll come back together later. It's not a trait. Like, yes, of
Yeah.
course, we are pouring everything into our kids, but we have to prioritize our relationships and invest in them, or we will lose them.
And this is exactly those examples that you gave is why it's such a personalized choice, right? I mean, what are the factors? What do you want? Like, I mean, that's, I feel like if we could just ask that question to so many more families, like, what are your goals here? Like, what is your relationship goals? Do you want your child to be independent sleeping? Using my own personal experience as well, I never co slept with either one of my child, even though my husband wanted it so badly. And by the way, my husband's an ER doctor. And he was like, I'm never going to get this opportunity. He just loves cuddling and loves closeness. And I said, sweetie, I don't trust myself enough because I'm a very deep sleeper. I roll over and I just don't feel like comfortable. There could be someone else that's like, nope, I'm good. I got it. It goes down to a comfort. But I love that you just really brought it into, again, I want to reiterate for the listener, you're talking about the safety, you're talking about are we getting sleep for the baby, and then you brought up are we getting sleep for the parent. And it all goes down to those foundational skills because I think there's a common misconception with co-sleeping that you become this feeding machine, that you become this sort of stir, wake up. But what are we teaching them about the same foundational skills for longer stretches that we should be teaching an independent sleeper, which is pause, like wait, like they may not need to be fed, they may just need a stirring moment. And so I love that you're bringing that in because I do believe that coast like any baby can be taught to sleep with longer stretches. Of course there are medical issues that can prohibit that, but it becomes this sort of situation that we tend to say, well, this is what it is. I'm just going to have to struggle. I'm going to be the smarter and I'm just going to be feeding my kid and co-sleeping until we're 3 years. But what if that's not working for you and no one ever taught you the other alternatives?
Mhm. Yeah, and also in my clinical practice, I work a lot with it. It sounds like a joke, but it's very serious, is like the burned out, pissed off 40-year-old mom. The
Yeah.
mom that has lost her identity in
Mhm.
motherhood, and now she has older kids, and my partner is thriving in his career. My kids are teenagers, they don't really respect me, and I've lost myself along the way, and now I hate everyone. And it does come out later. We talk so much about attachment security, especially the co-sleepers. the staunchly anti-cry it out folks really emphasize attachment security, attachment security, attachment
Yeah.
security. And my argument is, yes, you can foster secure attachment through thousands of interactions all day long. And what I very often see, and I think I have a glimpse that a lot of other moms don't, is I see what attachment security looks like when that child is 8 and 12 and 15. And when we have burned out moms that are yelling at their kids and they're swearing at their kids and they're calling them names and they're belittling them, that is much more harmful for attachment security.
Mm.
And so, especially when moms are mean on the internet, kind of my first thought sadly is like, okay, you're being really mean to other people that are out here doing their best. I don't know that I have a lot of confidence that when your child is kind of acting like an a-hole,
Right.
that
Which they
streak
will. Yeah.
is, yep, which they will. Like, we have to, as moms, practice being kind
Yeah.
even when we disagree with somebody, because we will disagree with the people that we love at home, and we have got to be kind. And when we are chronically sleep deprived, running on fumes, giving everything of ourselves to children who will not understand and will not be appreciative most of the time, we've got
Yeah.
to make sure that we have a full cup.
One of the comments that I hear online a lot is that what are we doing ripping our children away and putting them in an independent sleep space because biologically co-sleeping is what's meant to happen. And I you know I that phrase already gets me really concerned because again we are positioning that this is a superior thing for attachment when as someone who has two independent sleepers in a crib, they did take contact naps on us during the day, which are again, it's not black or white. You can have contact naps. You can have that connection. That's part of actually healthy sleep is that they may need that, and that's useful. But what are your thoughts about that phrase? About like, hey, co-sleeping is biologically normal, and it's what we're meant to do, so we should be doing that.
So I have a couple of thoughts and feelings. I think
Yeah,
one, just because something has been done historically does not mean that it's optimal, right? We can look back in history and look at a lot of things that were really toxic that
yeah,
we practiced for a long time. And I'm not saying that co-sleeping is toxic, but just the fact that humans have been doing this for centuries doesn't necessarily mean that that is superior. I think
yeah,
also our life now is drastically different than it used to be, especially our life in America, where I don't know how much maternity leave you had, but many of us don't have the luxury of having disturbed sleep all night long and then being able to take it easy during the day. We
yeah,
have incredibly high expectations. We have kids that are in a lot of activities that are trying to make honor roll, and we're trying to be at every single thing. And so we have so much pressure on us as moms. And in America, we have much less social support
yeah,
for motherhood. And so I love if co-sleeping is practiced around the world, that's great. But what are the other practices that support the family system around
right.
the world to account for mom doesn't have a break at night, mom's not getting deep restorative sleep? Like, we have if we're we have to look at the whole picture.
Yeah. And going back to obviously the risks and stuff, I do have another podcast episode with Dr. Daria, who's an ER doctor, about the risk of SIDS in general. Obviously, that doesn't just include co-sleeping. It includes babies who are sleeping in an independent sleep space and have blankets on them and have, bumpers and all that. So remember, when we talk about SIDS is sudden infant death syndrome. It doesn't mean that co-sleeping equals SIDS. It means that it can increase the risk, but so can other sleep practices. One of the biggest things that I've seen, and I always like to be clear of, we already talked about, the wine use, the drug use, alcohol use, even if it's one glass, melatonin you mentioned, like medications, the way that person sleeps, the sleep habits. I love that you brought that up. Premature babies is one of those things in the medical world that we are like a little more hesitant with premature babies, just because of some risk factors we see with prematurity, with SIDS there. And so co-sleeping is more of a risk. And one of the biggest things is not even in the bed. It's the falling asleep with your baby in other spots. So it's that co-sleeping on the couch. It's that co-sleeping because you're in a position that may cause them to go into a pillow or go into your chest. And so remembering that as like, that is our concern. And I also want to bring this up because I want to talk about data, because data is there, but the data is not all inclusive because we don't have data from other countries as well. But research from America shows that, for the 7,600 US sleep related infant deaths that we've seen in the last time frame, I can't remember the time frame that they saw that, 60% occurred in a shared sleep space. But is that a couch? Was there other risk factors? Like, I would love a study that showed me the risk of SIDS with a family doing all the things that we just mentioned, right? No medication, no alcohol, not in a rocker, not in like where their neck can bend forward like this, not on a couch. Like, I want that data, which we don't have. And that is why I say, we don't have that information to know that if you actually practice reduced risk co-sleeping,
Yes.
what is the risk factor there? And that is what's lacking. And that's why I think it's fair to have these conversations and say, hey, here's what we know. Here's what we know can reduce the risk. This is something that I want you to make a personal decision about, knowing that there is a risk there. But I don't know how you would approach those conversations, knowing what we know about the data. Because I love that you also like evidence-based information.
Yes. Yeah, I think, one of the biggest benefits that I found from my education as a whole was this calling to be a critical consumer of information. And,
Hmm.
I want to check the sources. I want to see the sample size. I want to see what the data is. And fortunately, in good data, researchers are directly calling out what are the limitations of this study and what are further areas that we need to examine. So that, in my mind, is what makes data the most trustworthy.
Yeah.
Unfortunately, we very rarely see that on social media. People aren't owning their biases. They're not owning that, like, here's my sample size, here's what else we need to explore. So I love that even in the way that you're framing it, it's acknowledging there's some crucial pieces of data that we don't have. And I think we would be benefited to get that data, because
Right.
there are a lot of people that are practicing harm reduced co-sleeping. And if baby's genuinely getting good sleep, if it's as safe as can be, if mom and dad are genuinely getting good sleep, if the parents' relationship is thriving, if it is actually working for the family system, I don't want people to be scared away from something that could be a good option. And
I
I
love
see
that.
that in the reverse too, right? Like, there's a
Mhm.
lot of fear mongering out there about sleep training. I think it's widely misunderstood. And I fear that also people are scared away from sleep training when it is, in fact, a reasonable option that works really well for a lot of families.
I'm very selective on what sleep consultants, sleep educators that I have on my show for this very reason.
Yep.
I there are really good educators that can educate on like the foundational skills out there, right? Like we talked about. And maybe they're educating about co-sleeping, maybe they're educating about that. But it's something to me that I love hearing you speak about both sides. And that is what this is all about, is that this isn't a you're superior, you're inferior. This is about parents having information and doing the best that they know with the information and resources they have. And that is my mantra in parenting, right? And you brought that up when you talked about the systemic issues. I know a lot of families in America may sleep train because of the going back to work, or maybe because of the jobs that don't allow them to be sleep deprived, right? Like my husband's an ER doc. We needed to sleep train our kids, but I also very deeply believed in sleep training. Like it wasn't like I'm doing it for my husband. I was like, no, like I know my son and daughter. Well, I didn't need to sleep train my daughter much, but like I know my son is capable. Like I've seen it clinically. And I also like to bring back that clinical component because we have evidence, but as a pediatrician, when we speak about sleep training and when I see the vilification of that, I'm like, I don't see any issue with attachment. And I'm not just saying that. I'm seeing it. And if I ever thought that this would cause any issue with attachment, I wouldn't recommend it. On the flip side, with co-sleeping, when I have those families coming in that are like, look, she sleeps in my bed, we make sure that there's nothing around her, and I'm like, listen, I'm letting you know that you are making that choice. It just makes it so much more cohesive and so much more supportive of the entire unit. And I really appreciate that. And when we go back to that conversation of like it's biologically normal. The concerns I have with bringing it back to science and evolution and saying that this is what I'm supposed to do, it just backhandedly shames the other side, right? Like, okay, so what you're doing is not biologically normal. You're removing your infant from you or from your room, and that, why would you do that? Like, it's this backhanded, you know, like this backhanded sort of dig at this person. So that's what I'm trying to remove a lot of when I see online, is like, I'm like, no, like there's nuance here. Can we just talk about like this? But to be fair, Chrissy, like I said it already at this beginning, me even having this conversation seems controversial, because
Sure.
how can a pediatrician talk about co-sleeping? But that shouldn't be the reality. Like, it really shouldn't. It should be. And I know there's so many pediatricians out there in the world that are very understanding of that same mind space that I'm in. And I just wish that that could be the case for pediatricians as well as educators online. But it's so hard.
Yes, it is so hard. And one of the other things that I am seeing a whole lot more is the reframe of a crib being, quote, like a cage. And it's
Yes.
like, hold
Yes.
on a second. Like, a crib is a wonderful, safe sleep space
It's
that your
so
baby
cozy.
has known their whole entire lives. Like, they do not
Yeah.
feel like they are locked and trapped in a cage. It is their sleep space. And so I think the way that we talk about these different dynamics can end up being so controversial when, like you said, it really doesn't need to be. Let's look at good information. Let's make well rounded and formed decisions from good information. Let's take individual factors into account. And let's realize that we can be invested in everybody's optimal well being. And it might look different from family to family. Like, your optimal nutrition might look different than my goal of optimal nutrition. Your favorite way of exercising might be different than my favorite way of exercising. I don't care.
I Yeah, exactly. And one thing that I'm curious if you know more about than me, because you're more in the sleep world, is something called the safe sleep 7.
Hmm.
Is that something that, so I want to, if you know about it, like educate me on, like, is that something that is very common? Is there any evidence to that? I mean, where is that coming from? Do you know the origins of that, and what is it?
Yeah. So I'm not the total expert here. So I'll tell you what I think I know. I
Yeah.
believe it was developed by the La Leche League, and
Yes.
it's 7 kind of tips or framework to have harm reduction, to make co-sleeping as safe as possible. So it's a lot of the things that we've already talked about. So no loose bedding,
Mhm.
sober parents, um, a firm flat surface, no extra blankets, baby's not swaddled, it's a full term baby without medical issues, no swaddle, did I say that already?
Yeah.
uh, yeah, so it's just 7 tips for harm reduction.
And so I'm on the Leche League website right now, and they have a song, and I'm just gonna sing the song.
Yes,
They have a
please
song. I don't know
do.
if you know this, okay? It's to the tune of "Row, row, row your boat," okay? No smoke, sober mom, baby at your breast, healthy baby on his back, keep him lightly dressed. Not too soft to bed, watch the cords and gaps, keep the covers off his head for your nights and naps. I like the song. Now, you said exactly. I just, again, I'm looking it up because I've heard that Safe Sleep 7. I want to be clear with everyone listening that there's, again, no evidence to support. And that doesn't mean that it's bad. There's no evidence to support that. Does this actually, how much does this reduce the risk of SIDS? And from someone who is evidence based, a lover of evidence based medicine, it doesn't mean that we can't do it. It just means that we just don't have the data, right? And so that's kind of what we went back to. And the data that they have from the La Leche League is that even though many don't plan to bed share, a lot of breastfeeding moms, about 60 to 75% eventually will, which I know we know that number is probably really valid. And so, yeah, I just wanted your thoughts, because I hear that thrown out a lot in the ultra co-sleeping world, like the world that is very pro co-sleeping, anti-sleep training. And I want to just be clear that we just don't know how much risk reduction that is. And so, again, doing that sounds like a good risk reduction strategy. Nothing sounds outlandish to you,
Yeah, but
but
it
we don't
doesn't
have all
take
the
it
info.
down it doesn't take it down to 0, and I
Yes.
think that's where, again, the polarized nature of these conversations can be detrimental, if we
Yeah.
are saying, as long as you do the Safe Sleep 7, your baby will be fine.
Yes,
We
correct.
don't have the data that says that. And so anytime we make any choices with our children, we just have to be informed of the risks. You know,
Yeah.
teaching my
Mm.
kid how to ride a two-wheeler, and there's a risk that she falls down and crashes and scrapes her knee or breaks an arm. Like it,
Yeah.
but if I know the data, if I know the risks, and if I can weigh that out in my mind, then again, we're all out here just doing our best. None of us is going to be a perfect parent. And actually what I find incredibly relieving in the data is this idea of good enough parenting, that our
Mhm.
kids actually don't need a perfect parent. And very often in our quest to be a perfect parent, it actually backfires because we do over parenting behaviors and we take
Absolutely.
away our kids' ability to achieve some resilience. It's actually really, really important for our kids to be uncomfortable sometimes. It's fine
Yeah.
for them to be lonely sometimes. It's great for them to be bored. We want our kids to experience struggle in manageable ways consistently all throughout their lives.
Yeah.
And what we're seeing in a lot of kids these days is this inability to cope with hardships that used to be manageable. And so I love the work of Jonathan Haidt and the Anxious Generation, and just kind of recognizing that, wait, like we have to be giving our kids opportunities to learn grit and resilience
Yeah.
and navigating hardship. And then the other thing that people talk about a lot in co-sleeping circles is this increase of cortisol in
Mm.
babies when they're sleep training, or increases in cortisol in moms during the sleep training process. And both of those things are true. They have found that in sleep training studies that babies' cortisol increases, and so does moms. But what they also found is that 3 days later, mom's cortisol is back at baseline. And sometimes that's framed as like, see, look, mom stopped caring. And I would say, like, well, the cortisol was never out of range.
Yeah.
And what if mom just got confident in herself, confident in her child, and this thing that used to be stressful no longer is? Isn't that the goal? We
Yeah.
should be allowing our babies to experience some cortisol spikes, like when they get out of a bath and they're cold, when we
Yeah.
are changing a diaper and they are not a fan of it, when we are sucking boogers out of their nose, when they can't get that ball that went behind the couch. It is good and normal and helpful to let our kids experience stress that they can then also learn to downregulate and find mastery.
Mm. I actually have one of my most popular, most downloaded episodes was actually one of my first episodes when I first started this podcast 6 years ago. I can't believe it's been 6 years, where it's called Crybabies and the Truth About Cortisol and Sleep Training, and it was with a therapist, and we talked about the person who I spoke with does research on cortisol. And
Yeah.
so she was talking about it, and we talked exactly what you just said, and it was a very nice conversation. So if you're interested in that, Crybabies on my podcast. It's a really good one about cortisol. And so, I love that I'm chatting with you because you're also an LMFT. And by the way, I love LMFTs. My therapist is an LMFT. I think y'all are like the goat. But the fact that you're an LMFT, you obviously understand like therapy, but you also understand psychology. You also understand now sleep training and sleep education, with your training as a sleep consultant. So there's so many online debates around sleep, which can be very loud and aggressive, which is what we mentioned. And a lot of parents feel judged or scared into defending their choices or being confused on what to know. So, how would you recommend parents sort of filter through social media noise or accounts to make sleep decisions based on safety, evidence, and what's right for their family?
Yeah. So I kind of go back to some of the main considerations. One, are we making decisions from good, reliable evidence and data? Are we acknowledging that there is no one size fits all, and I'm allowed to be empowered to figure out what is right for me and my family? And I can also give others the grace to do the same. I, quick side note, but one of the things that I often find, especially in how loud and polarizing it can be on social media, and I think people get really activated and up in
Mhm.
arms when there's the perception of a child being mistreated. And I
Yeah.
always like to remind people, like, there are thousands and millions of children in this country that need your advocacy. Sign up for
Correct.
CASA. Go help the children and advocate for the children that genuinely need an advocate. If we are shaming a mom online because she has a different practice, if her child is okay and they're healthy and thriving, we got to just let her be. And we need to support those moms. And I think just realizing that if we check our sources, check our data, and we genuinely tune in to find our best, our right, most of the time we're going to be fine.
Yeah, I love that. And again, that watching for the polarization, outlandish sort of comments, the vilification of the other end completely without offering risk reduction strategies or, the lack of nuance and lack of supporting data, I think is so healthy. And, you're right. I had done a video about how I don't care if you sleep train because I know truly. I don't care. Like your child is going to be okay as long as you don't raise an asshole kid. That's why I said I'm like, just don't raise an asshole kid. But that has nothing to do with sleep training or co-sleeping. That has to do with everything on how you parent outside of those moments, like you mentioned, that woman who's yelling at you behind the computer screen. How are you approaching your child when they're
Yes.
not agreeing with you? Because I'm pretty sure you're not giving them the compassion to not be an asshole kid. I mean, let's be quite honest. Now, tell me more about your book. I want to hear more about your book. What inspired you to write your book called The Peaceful Sleeper? Obviously inspired by all the work that you do. And is there a section on co-sleeping in there?
Yes, I do talk about co-sleeping. The
Mm-hmm.
book really is about evidence-based practices, turning down the noise on social media, kind of taming the Wild West, and teaching parents how to filter through information and misinformation to find your right. Realizing your right might be different than your neighbor's right. And so, what matters is that you are finding what works best for your family. And I also kind of weave in psychology and parenting practices that we can implement in the infant stage. Things like resilience and
Mm-hmm.
believing that our kids are capable. I think a lot of times in the conversation, we accidentally are saying and framing a lot of my kid couldn't handle this. We accidentally frame our children as incredibly fragile, and
Mm-hmm.
that leads to a lot of anxiety and learned helplessness that we don't want. So instead, as parents, in these small bite-sized ways, we can find confidence in ourselves and find confidence in our kids so that we can promote secure attachment and promote resilience and the outcomes that we actually want in childhood. There's a lot talked about in gentle parenting, conscious parenting. A lot of these constructs sound really nice, but there's
Yeah.
not really a data evidence base behind it. So where the evidence currently is, what we call authoritative parenting is the goal. That's kind of the gold standard. And that is high warmth and responsiveness and high limits and expectations. And so every parent, I believe, sets out to be the best parent that they can be. So my goal is that it's like a data driven warm hug that says, you are doing your best, mama. You are trying your best. Here's a couple things to think about. And I just want you to get good sleep. And I'm going to teach you 4 different paths to do that and how you can be empowered to choose your right.
Mm. It's funny is I'm in my book proposal process, and guess what my book is about?
Oh, tell me.
Authoritative parenting. Because I feel like, if you actually look up authoritative parenting book, nothing comes up. There's no parenting book on authoritative parenting. So I was like, hey, and everyone keeps asking me because that's how I practice. I don't have labels of gentle, positive, any of that because you that's all under the umbrella of authoritative parenting, but the research has always been around authoritative parenting and that you can't deny the decades of research that show that high warmth, high connection is so important there and high boundaries. So yes, it's so funny that you brought that up, but I really appreciate that. And I just think this book is so important and the work that you do is so important.
Thank
Now,
you.
if you could redesign how we educate parents about infant sleep from the start, what would you change? Maybe give me 1 or 2 things 'cause I know you'd wanna change a lot. Or what would be those 1 or 2 tips that you'd give, whether a family is co-sleeping, independent sleeping, what would be those 2 tips on like what you'd wish they would know about newborn sleep?
Yeah. So when we're talking about newborn sleep, I think it's important to very clearly teach safe sleep practices and
Mhm.
risk reduction. And I deeply believe that also needs to be combined with some tools and strategies to get optimal sleep for your baby so that parents aren't just desperate and resorting to whatever at 3 o'clock in the morning.
Yeah.
So, for newborn sleep, my 4 pillars are we've got to optimize feedings, get as much in our babies as they can reasonably take at every feed. We want to optimize timing. I think a lot of times we miss those sleepy signals and then we have a wired and overtired
Yep.
baby. We also need to figure out the mystery of our little baby and figure out optimal calming strategies. How do
Yeah.
I keep you calm, happy, and content as much as possible day and night? And then number 4, eliminating sources of discomfort. There are
Yeah.
sometimes physiological or neurological things that are getting in the way of baby being calm and content. And I want to have as many resources geared towards that as possible. So if we can lay the foundation of a happy, thriving, well rested baby, independent sleep comes later and is so much easier building off that foundation. I think
Mm.
you said your daughter didn't even really need
Yep.
to sleep train.
Because we did those foundations, right.
Exactly. And that really my broader lens is like, congratulations, you sleep
Yeah.
trained your baby in a different way because you taught her the framework, gave her that support, and then in some way, shape, or form, you stood back and witnessed what she could do on her own. And then you supported that independent learning process. So you did sleep train. It just looks
Yeah.
different than with your son.
And I love that you mentioned because again, the feeding, the timing, okay, maybe that's, that's obviously going to be different on the baby in terms of amounts and stuff like that. But the calming strategies, I love that you brought that up because so many families they forget that you're learning about another human being, right? So like what works for my son for calming him down was not the same strategies my daughter needed. And that is that temperament piece because I also find that there's educators that will say, well, all babies have different temperaments. 100%. But we doesn't mean that they can't learn to sleep, like whether that's independently, all that stuff. But like it's learning, okay, my daughter was a very cuddly sleeper. So in order to transfer her, I could not just do a transfer. I had to hold her for quite a bit of time, rock her down, get her very cozy, and then do a transfer. She needed a lot of bedside reassurance. My son was not that kid. And so it's one of those things that temperament also has to do with the level of cuddliness they need. And like I call it the cuddle quota. That's my
Yeah.
term of like, how much cuddle quota does your kid need? Because some kids don't need a lot of cuddles. Some
Yep.
babies need a lot more cuddles, and that can be the differentiator. But I love that you bring those foundations. Well, my final question to you is what is something that that's bringing you a lot of joy in your life right now or making you so happy? Mm.
You know what? I'm in such a sweet spot with my girls. I have 4
Oh, I love
daughters.
it.
They're 12, 10, 7, and 5, and
Amazing.
it's so much fun. Like, there's a lot of time in those early years that, yes, parenting is so rewarding, and we have these really sweet, endearing moments, but I am having so much fun in mom life right now with my little gaggle of besties.
I love the gaggle of besties. Oh, thank you so much. And where can everyone go to stay connected and get your book?
Yes, you can find me online on all the social channels at The Peaceful Sleeper, the.peaceful.sleeper. Our website is thepeacefulsleeper.com. And then book has the same name. You can find it from all the major book retailers.
Well, definitely get the book. I will be reading it as well because I'm always interested in learning things that I may not know. And so I can't wait to learn from Chrissy about all her sleep guidance. Her Instagram handle obviously is a wealth of information too, but kudos to you on the book. And thank you so much for joining me on this very important conversation today because I hope people can understand that we both are in this world to promote sleep, promote whatever families want, but also make it the safest possible way that we can do it. So I really appreciate you joining me today.
Yes, thank you for having me.
And for everyone tuning in, if you love this conversation, please make sure you subscribe to the channel, make sure you share it, put that thumbs up sign down below, and ask any questions you may have. And so, whether Chrissy can come back on or I get someone else to come back on, I'd love to continue these conversations with you. And that's the way that this channel can continue to grow, and I can continue to bring you amazing conversations on the show. Until next time, stay well, everybody.